Hi Zoe, welcome in.
Hi, thank you.
How are you doing today?
I'm okay. I've been having some migraines, and so I just wanted to come in and see if you could tell if anything was going on.
Thank you so much for coming in today. We're always happy to see you. I am going to go ahead and verify your first name and your date of birth, please.
Zoe, Z-O-E, and my birthday is June 3rd, 1998.
Okay, and then just a few brief questions to catch us up on your chart here. Do you currently take any medications?
Just my birth control.
Do you have any new allergies since the last time that I've seen you?
Not that I know of.
Gotcha. Have you been out of the country in the last 6 months?
No.
How has your sleep schedule been?
Not that good.
Needing a little word?
Yeah.
How many hours per night do you estimate that you normally get?
Like 6 or 7.
Gotcha. Definitely want to shoot for at least 1 or 2 more. Okay, tell me a little bit about what's been bothering you today, Zoe.
My head just feels really like congested and just have really bad headaches very frequently.
Okay.
Maybe like a little bit of loss of sensation.
Gotcha.
I don't know if it's vertigo or what it could be.
When did you first notice this coming on?
Like a couple weeks ago, I would say.
A couple weeks ago. Have you noticed any kind of like runny nose, any sinus issues at all?
A little bit.
Have you tried any like over-the-counter treatments, been taking any Tylenol?
I sometimes try with the Tylenol, but I don't feel like it helps.
Gotcha. Okay, so I have updated your chart here. We are going to go ahead and conduct a cranial nerve exam today to take a look at the symptoms and see how you fare. And then we're going to take a look at the skin as well to make sure that the sensations are functioning as they should be and hopefully get to the bottom of what's been bothering you.
Okay.
Great. I'm just going to set this to the side, put on my gloves, and we're going to begin by taking your blood pressure.
Okay.
Okay, so is this arm a good arm to do the test on?
Mm-hmm.
Okay, go ahead and relax for me and uncross your legs. Okay, great. You have a normal reading today, which is a great sign. Just going to gently remove this from your arm. I'm just going to write that down in your chart as 120/80. I'm going to go ahead and put on my gloves. Okay, Zoe, are you comfortable with me touching your head?
Yes.
Great. I'm just going to gently palpate the skin, feeling for any raised lumps or bumps, making sure that there's no lesions in the skin. Would you say that these headaches tend to focus more on the temples, the forehead, behind the eyes?
I would say the forehead and then all the way to the back of my neck.
Okay. Just gonna gently feel. I'm not feeling any kind of excessive swelling or raised lumps, which is a great sign. And I'm just going to gently palpate the face. Feeling for any kind of lumps, any swollen lymph nodes. Are you experiencing a headache right now?
A mild one.
Okay. The lymph nodes don't feel to be excessively swollen, which is a good sign. I'm not feeling any excessive swelling in the face. I'm going to go ahead and just gently percuss along the face to feel the bone structure. You can just go ahead and relax and close your eyes. Just gently bringing my fingers around the bone structure of the face and gently tapping the hammer to feel how the skin and the underlying structure reacts to the additional pressure. Okay, everything is seeming pretty healthy so far. I'm going to move on to the cranial nerve aspect, where we're going to do a few sensory tests just to check in and make sure everything is functioning as it should. First, I'm going to go ahead and take a look into your ears. I'm just going to gently push your hair back and ask that you face that direction for me. Thank you. Just going to gently insert this into your ear. Take a look. I don't see any excessive redness or swelling or any drainage, which is a great sign. I'm going to have you take a look over your right shoulder and into the left ear. Great, it's the same on this side. No excessive redness or swelling. Everything is looking healthy and is functioning as it should. We are going to go ahead and conduct a hearing test. I'm going to ask that you face straight ahead and close your eyes. I'm going to be using my tuning fork here into two positions. You're going to tell me which one you hear louder, position 1 or position 2. This is position 1. This is position 2.
2.
Great. This is position 1. This is position 2.
1.
This is position 1. This is position 2.
2.
This is position 1. And this is position 2.
2.
Great. Go ahead and stay in that position and keep your eyes closed for me. I have 2 little shaker eggs here. I'm going to go ahead and shake one. You're going to let me know if you hear it on your left side, your right side, or both sides at the same time.
Left. Right. Right. Left. Both. Right. Both. Left.
Lovely. Now I'm going to go ahead and take a look inside your nose. If you wouldn't mind tipping your head back for me, I'm just going to insert my light here. Great, I don't see any excessive redness or any swelling. No discharge or drainage. Lovely. Have you noticed any problems with your sense of smell lately?
I don't think so.
Great. I'm going to go ahead and just hold this vial up for you while covering, make sure you can see the scent. You're going to take a big inhale at my command and then let me know which scent it is that you smell. And inhale.
Lavender.
Yep. Great. I'm going to do another one here. Go ahead and inhale.
Like a floral scent.
Great. And we're going to do one more. In this tiny little perfume bottle here, I'm just going to spray it onto my glove and have you inhale.
Oranges.
Yep. Great job. Now we're going to move on to the sense of taste. Okay, Zoe, go ahead and stick out your tongue and say ah.
Ah.
Great. Don't see any swelling in the tonsils, any excessive drainage, no scars or lesions. Everything is looking very healthy. Have you noticed any problems with your sense of taste?
A little bit.
A little bit? Okay. I'm going to go ahead and drop a drop of this onto your tongue. Go ahead and stick out your tongue and let me know. And there. What is it that you taste?
Tastes sort of like cherries a little bit.
Okay. It's this one is going to be strawberry, so we're definitely in the right realm. I'm going to do another one here for you. Go ahead and stick out your tongue for me. And there.
Like caramel.
Yep, it's like a toasted s'more. So we're a little bit off. Definitely going to take a look at that
Okay.
after we're done here. Now we are going to move on to the eye test. First, I'm just going to ask that you keep your head pointed straight ahead, but your eyes follow my fingertips, moving only your eyes and not your head. Great. Okay, perfect. Now let me know when my fingers come into your field of vision.
Now.
Okay.
Now.
Great.
Now.
Lovely. Go ahead. Take a look into your eyes. Okay, so we go ahead and stare right here at my nose. Just going to check for pupil rounding and dilation. They are round and reactive to light. Lovely. Now I'm going to go ahead and conduct an eye test. I'm going to have you extend your right arm to hold this chart and use your left hand to cover your left eye. I'm going to go ahead. Point. What is this letter?
E.
Okay, Can you read me this row starting from the right and moving towards the left?
S, B, J, H, D.
Great. Now I'd like you to read for me this row starting from the right and moving towards the left.
H, P, F, D, L.
Great. And what is this letter?
T.
What is this color?
Red.
And what is this color?
Green.
Great. Now we're going to go ahead and switch our hands and eyes. Lovely. What is this letter?
L.
Go ahead and read for me this row starting from the right and moving towards the left.
H, P, F.
Great. Go ahead and read for me this bottom row starting at the right and moving towards the left.
H, P, F, T, L.
Great. Go ahead and read for me this row starting at the left and moving towards the right.
D, H, J, B, S.
Great. And what color is this?
Blue.
And what color is this?
Red.
Okay. This is going to be a green color. We are going to definitely look into that. I'm just going to make a note in your chart. Otherwise, though, pass with flying colors. I'm just going to go ahead and take a moment to record our findings for the day. We're going to take a look at the sense of smell too, as well as the eyes, just to give make sure there's not any developing color blindness. Okay, now I'm just going to do a brief reflex test. I'm going to have you smile for me and frown. Go ahead and raise your eyebrows. Great. Go ahead and look to your left, pushing against my hand. Great. And look to the right, pushing against my hand. Great. Try and shrug your shoulders. Great. Go ahead and put your arms out in front of you. I'm going to try and lower them. Don't let me do that. Great. I'm going to try and raise them. Don't let me do that. Great, and you can relax. Okay, so we've passed these tests with pretty flying colors so far, which is a good sign, but we definitely still want to get to the bottom of what's been bothering you. I'm going to move on to the sensory portion of this exam. You can just go ahead and relax. I'm just going to move your hair, and I'm going to explain what we're doing as we're doing it. First, I'm going to be conducting a warm or cold test. This is the tool I'll be using. It's going to be nice and cool on the skin. Here's an example of what that will feel like. This is what warm is going to feel like. I'm going to have you close your eyes for me. This is that cold sensation, and this is the warm one. Do you notice a difference between those?
Yes.
Okay. I'm going to go ahead and press the object in your skin. Let me know if that is warm or cold.
Warm. Cold. Warm. Cold. Cold. Warm. Warm. Cold. 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 Warm. Warm. Cold. Cold.
Cold. Warm. Warm. Cold. Cold. Warm. 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 Cold. 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 Great. You did a lovely job with that. I can tell that the sensations are definitely reacting to warm versus cold. Now we're going to do a sharp or dull test. It's the same concept, but we're testing the sensation in a slightly different way. If you go ahead and close your eyes for me, this is what dull is going to feel like, and this is sharp. Do you notice the difference between those two sensations?
Yes.
Great. I'm going to go ahead and start. You let me know if the sensation that you feel is sharp or if that sensation is dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Great. I'm going to do the same concept with a slightly different tool. This is just a sensory sponge. This is what the dull will feel like, and this is the sharp. Do you notice the difference between those two sensations?
Yes.
Great. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. issue with the sharp or dull, I'm just going to go ahead and make a note in your chart for that.
Okay.
That's definitely a clue to point us in the right direction as to what's been bothering you. Now I'm going to switch over to measuring just to see if there's any areas that have any inflammation or swelling in the upper body. You can go ahead and just relax and close your eyes.
Okay.
And I'm going to go ahead and measure and take notes. Okay, I'm just gonna go ahead and do some measurements. You can feel free to close your eyes and relax. Be measuring along the face, making notes. Measuring from the top of the forehead to the chin. And we're going to be measuring around the skull. Measuring from the end of the eyebrow down to the chin. Making sure that both sides are even. Measuring from one end of the shoulder to the other. Measuring the collarbones. Measuring from the shoulder down to the elbow. Making sure that both sides are symmetrical to make sure there's no excessive swelling. And measure the neck. To measure from ear to ear. To measure from elbow to wrist. Okay, I have your measurements recorded. It doesn't seem like there's any excessive swelling, which is a good sign. The last thing I'm going to do is just like an acupuncture test. I'm going to be using this tool here. It makes a little bit of noise as it presses into the skin. It shouldn't be too painful. Does that cause you any discomfort? No. Great. You can just close your eyes. I'm just going to be going over the structures of the upper body and pressing this acupuncture tool into the skin. I'm looking to see how the skin reacts. See if there's any excessive redness. How quickly this mark that I'm gently pressing into the skin disappears. Looks like it's fading in about a few seconds, leaving a bit of redness behind, which is the desired outcome. Just let me check. Do your other side here. Okay. Alrighty, so that's going to be concluding our exam for today.
Okay.
I definitely like the results that we found today, although nothing was too conclusive about what is causing your headaches and the loss of sensation. We are definitely not going to give up trying to find the source of your discomfort. For now, I'm going to go ahead and prescribe you a medication that you can pick up at your local pharmacy. It's going to be alleviating a lot of your pain. We're also going to schedule an appointment for you in around a week to do some further testing.
Okay. Thank you.
I'm just going to write down the date of that appointment here. And I look forward to seeing you again soon.
Thank you.
Thank you for coming in today. Bye-bye.